NAN leaders, community members, and frontline workers are coming together this week to address a mental health and addictions crisis in their communities. It's in response to a call from NAN chiefs for a mental health summit during their spring assembly 2 months ago. Lee Noonan has more.
About 130 people gathered at the Nor'Wester Hotel, with another 50 or so participating virtually. NAN Grand Chief Derek Fox says it was a challenge to organize the event in so little time, but the issue of mental health and addictions dominated the spring assembly, with NAN chiefs telling him they need to address the issue urgently.
How can we get to work when there's so much of these issues that we need to deal with first?
The goal of the summit is to consult with communities to inform NAN's strategies and generate a report that will be shared with partners at all levels of government. Fox emphasized that long-standing challenges, including addiction, suicidality, and trauma, were exacerbated by COVID-19 in northern First Nations.
I think this did a lot to their mental health, their spirit, even their physical health.
The solutions under discussion here are even more numerous than the problems they address. Caring for the mental health of children was an important theme, as were land-based approaches. Brenda Fox of the NAN Women's Council says she hopes to see a balance of medical treatment and cultural approaches.
So we have to be careful and mindful for the ones that are very deep into the addictions, that need that support from the doctor and nurses.
Russell Wesley, chief of Cat Lake First Nation, estimates that 80% of his community is in active addiction or in recovery. Wesley says he was part of the fight against solvent abuse in the 1980s and feels solutions are available, but that they need federal support to fund them. And he asks where the Minister of Mental Health and Addictions has been.
We're dying out here, and you're sitting over there doing nothing. It's been a year since Mr. Bennett was assigned a portfolio, and I've yet to see a program. I've yet to see a funding regime. I've yet to see an action plan. I haven't seen it.
Grand Chief Fox confirms that he's not heard from the ministry either, but he hopes that they will pay attention to the results of this summit.
Health. So it is our hope that when we go knocking on the door or send our report to them, that they respond with some support, and that the ministry acknowledges that we need help.
TBT News reached out to the Ministry of Mental Health and Addictions for comment, but they did not respond before broadcast time. The summit will be continuing here through till end of day Thursday, with breakout sessions on a variety of mental health and addictions topics. Lee Noonan, TBT News.